I'm a plastic surgeon. 90% of my work is taking care of women affected by breast cancer. I received a message in the operating room while I was operating saying that UnitedHealth was calling me and wanted to speak to me right now. So I thought, what are they doing now? They're going to hurt this patient who's having surgery to treat breast cancer actively under anesthesia. And you're calling me in the operating room. I said, hey, I think I better take this call because I'm thinking they might charge her cash for this, or she might get some exorbitant bill. United Healthcare wanted me to call them about one of the patients who was having surgery today, who was actually asleep having surgery. When I asked them to give their name, their credentials, their license number, they declined. They said, it's for our safety because our CEO was murdered. So you have two doctors on the call. Will either of you give me your name or MPI number or license number? The reference number for the call, but you won't give me your name or number. So we're speaking about lymphedema of the arm. So this is not an area that you're familiar with, correct? But you're my colleague in plastic surgery, and you won't give me your name. I understand that the CEO was murdered, right? But I'm your peer, and I want to have a conversation with a peer about a patient who has breast cancer and lymphedema. How do I know who you are? How do I know that you're board certified and that you're a microsurgeon? Here I am trying to get a cancer patient treatment that's necessary to keep her working. She's actually a physician, needs to use her arms. That's their member who's been paying premiums into United. They didn't know that this patient needed radiation. You can injure a patient and take both of her rectus muscles to make breasts, or you can be a really elegant, delicate surgeon and do a surgery that's hard on the surgeon and easy on the patient. And insurance tried to say that those were worth the same thing. And United was the first company that kind of sent me the letter saying, we're not going to pay you anymore for the delicate work. We're going to pay you at the barbaric surgery rate. It's just shocking.
Let me tell you a story that really alerted me how bad things were. And this was in the 90s. When I really knew we were in trouble is when I got a call from an HMO administrator who was a physician. He said, I want a 3-day detox rate. And whatever the rate was going to be, it was going to be something markedly lower than what it actually cost to take care of the patient. But that wasn't the issue. I said, look, we're starting to see your patients. You require them to be discharged in 3 days. It's demoralizing my staff. I said, I'll tell you what, you name your price, anything. I was offering him the world, and I'll treat them across levels of care. We have outpatient and residential. I'll figure out where to put your patient, and I'll take the risk. You name your price. He goes, no, I want a 3-day detox. I go, what are you talking about? Do you imagine that after they have a 3-day detox, they're not going to go out, that's treatment, they're not going to go out and use? He goes, oh no, they'll go out and use. But if they do that 3 times, then they lose their job. Then they're no longer my concern. So the patient discharges, they kill themselves, and the insurance company goes, we don't practice medicine. There's Dr. Pinsky's signature on the discharge order. Has nothing to do with us. Wow. Then I complain to the insurance commissioner. Next thing I get is a call from the CEO of the hospital freaking out. This insurance company, a big one, is threatening to decertify the entire hospital because I don't approve of their business practices. So this is how they do it. This is how they do it.
It is. America needs to understand what we're dealing with.